Hi guys, it's Karen, and today's video is very special because I'm collaborating again with my pelvic floor physical therapist, Aditi Chandan from AmeriCare Physical Therapy. And what we're doing is showing you 3 core exercises that she uses with a lot of her pelvic patients, and she has used them with me, and I do these exercises a few times a week on my own. And so I wanted to demonstrate the exercises, and Aditi was so kind to offer to do the voiceover so that you could walk away from this video hearing straight from the pelvic floor physical therapist's mouth exactly how to do these exercises and why these exercises are so important for someone with pelvic floor dysfunction. So here we go. I hope you guys enjoy.
Here we can see a modified inchworm. I say modified because the true inchworm is walking the hands out into a plank and then walking the feet in to meet the hands. This version can be a lot of strain on the low back as well as the hamstrings, so can be uncomfortable for many individuals with pelvic floor dysfunction. I instead prefer walking the hands out to a plank, holding for a second or two, and then walking the hands back. By doing it this way, you can actually enhance recruitment of some of your back extensors, your glutes, and it can be a little bit easier on any tight musculature if you have some decreased flexibility. One of my favorite multi-joint core exercises is the dead bug. Seen here is actually a modification or advancement using a physio ball. Any form of a dead bug is going to recruit all 4 layers of our abdominals, including our transverse abdominis, that's our deep girdle-like stabilizer, our obliques that help us with side bending and rotation, and of course, our rectus abdominis, which is the one we can see, often called the six-pack muscle, even though it doesn't help us very much with our strength. By adding a physio ball in, we also bring in some extra recruitment in our arms and legs. The exercise is performed by laying on your back flat, putting a ball kind of in between your hands and your knees, and then bringing the knees up to about a 90-90 tabletop position. Then you alternately extend opposite arm and leg while simultaneously pushing into the ball with the one knee and one hand that are in contact with it. This way we get a whole body core activation. In general, in our physical therapy practice, we try and do a lot of multi-joint exercises. This is because throughout our day, we are never using just one muscle group to help us walk, balance, lift, and overall function. I've always been a fan of saying, work smarter, not harder, and some of these exercises are a great way of doing that. Here, you're going to see Karen doing a Russian twist seated on a BOSU ball. BOSU stands for both sides up. Many a time people will do this sitting on the floor, but I find that especially with those with pelvic floor dysfunction or pelvic pain, sitting on the floor can put a lot of pressure on the tailbone. I love putting people on unstable surfaces because that actually allows for increased muscle recruitment. As you can see, the exercise is performed by sitting on the round part of the BOSU ball, slightly leaning back, and then either stacking your feet for a simpler version or slightly raising them up for a more advanced version. At the same time as you're maintaining this gentle core activation, you are rotating your trunk from side to side. The easy version would be just clasping your hands and rotating from hip to hip. Harder version, throw a weight in your hands.
We hope you guys found this video helpful. If you did, please give it a thumbs up. Don't forget to subscribe and hit that notification bell so you know every time I upload a new video. Thank you so much for watching, and I'll see you next time.